passport.
Okay, that's a shame.
So if you find a passport somewhere, please return it to the registration desk. It's Paul Alfred's passport.
All right, so if you find a passport, bring it back. Okay, without further ado, I think we're going to move into the afternoon program. I think this will be the last part of the program, isn't it?
I'm sad it's the afternoon of the last day.
Yeah.
Do you still have enough energy for the last afternoon? Yay!
Yeah, a bit more, come on.
That's not...
Yeah, nice. All right, great. Well, with this positive energy, I think we need to move into the next positive session, because it is about positive psychology. And I think Machteld Huber will talk about it, so we will not be on stage for too long. Can I get the enthusiasm that we had just had? One more time for Machteld.
Okay, hello. I'm Dutch, so you will hear that immediately from my accent, but by now you're quite used to Dutch accents, I guess. I was announced as what influences our positive psychology and positive health, and how can we improve it. But I decided to change it. And does it work? Yes. I will speak about what I call positive health, which is a Dutch practical approach to engage people into a process towards more health and well-being. That is what I'm going to talk about. And my background is that I was a general practitioner, and I became seriously ill myself as a young doctor. When I was 30, I ended up in hospital with a severe disease. And I knew medically what I had, but being a patient was a complete new experience. I was astonished of what I felt, how my body told me what I needed, etc. And I thought, why haven't I ever heard anything about being a patient during my studies? Okay, I recovered, I went back to work, and I got ill again with a different disease. A second one, and then a third one, and then a fourth one. Between 30 and 35, I had 4 different diseases, of which the last one was cancer. So I'm a very experienced patient. And from the second disease, I decided I'll study myself. Were very difficult years. I was really very ill. But I decided to study myself as a patient to notice if between the different diseases, if I experienced different things, if the things that my body told me that would be good to me differed. Anyway, what it brought is that when I was 35 and more or less recovered, I decided the medical knowledge is wonderful, but we leave outside so many possibilities. I want to add to healthcare what I discovered what patients can do themselves for their well-being, for their recovery, etc. So that became my mission. I can tell you I'm 72 now. And and I enjoy life and I feel very healthy, although my back aches a little bit. But what I decided, I'm going on a mission. I don't know where it will end, but it doesn't matter because it gives my suffering a meaning. It makes sense for myself to work with the experiences I had. But I knew if you want to change healthcare, it needs to become science. So I decided to stop as a general practitioner, what I found very difficult because I loved my work. But I became a scientist on one hand, which I was for 30 years. And I decided, where possible, I would remain working with people, but then I wanted to work with really damaged people because I had discovered with myself the sources of health, vitality, etc. And I wanted with these people to see how far can people restore. And so I worked for several years with people with drug addiction, and later with people with war traumas, different war traumas. And I'm very, very impressed by the resilience that people have and the way you can really help them become healed again, if you know how. So that's my background. For many years I worked in silence. I did all kinds of research also on the health effects of organic food, etc. But I studied resilience and I ran into the problem that I was not allowed to call resilience health, which I thought was ridiculous. But that is because of the definition of health. And I started to work on the definition of health, and I'm going to tell you what came out of that. Well, let's go. First of all, we are used to speak about health care, but I state that, in fact, it is disease care. I think we are addicted to diagnosing and trying to diagnose and to treat. And this is shown very much clearly by this picture. It's a picture of a CEO of an insurance company at his welfare talk, and he said, this is how the money, this is the Netherlands, but I think in different countries it's not very much different. This is how the amount of money is divided on the left-hand side. And you see, oh, I see myself. You see mental care, hospital care, so the acute care and the long-term care, where the most amount of money goes. Much less goes to the general practitioners, the first, we call it integrated first line. But the message of this picture is that all the blue part is about people with a diagnosis. They are somehow called ill. And at the bottom you see this small pink triangle, and this is what we now relatively spend on prevention. I was shocked. And it is really like this. In the Netherlands we spend 2.5% of all this money which goes to treating people, we spend on prevention. But the interesting thing is that this health insurance man said we go to the right triangle. We get a complete change. And it doesn't mean that all the hospitals will disappear, but we'll get less. You see that the integrated first line, where the doctors are close and the care is close to the people in the communities, will become larger. But the biggest difference is this pink small tip at the left side will become the basis. And then I thought, great, this is exactly what I experienced and what we should do. So this is one impression of what is changing. I give you another impression. This is from TNO. It's a big Dutch research institute in the Netherlands, very respected. And they show here the normal, you can say, physiology of people. If you know your blood test, we have kind of between the lower two lines where you see homeostasis, these are the levels where our blood levels can kind of fluctuate. If you get stressed, you may raise a little, and if you are healthy, it goes back. And when it really goes wrong, you end up at the right top, where it's about disease. And I don't know how many people have experience in studying medicine here. I studied for 8 years, more or less just about the top right part. I learned about diseases which I will never meet. It was all about that, and I respect that knowledge very much. But during my studies, I got, in 8 years, 4 hours about nutrition. So hardly anything about how to strengthen this healthy situation of homeostasis. And the striking thing is that this big state institute says we should go from disease management towards enhancing health. Focus on resilience. So you see this movement goes that way. It means that we need to learn to think completely different. And this is shown in these two pictures. It's all about how do you keep this green ball in place. And on the left-hand side, you see this kind of hill where the ball is placed. If the arrows would not be there, the ball would fall down. So it's an instability. The arrows keep the ball in place, and you call that a control model. This is how I was raised as a doctor. With all chronic diseases you treat with medication for diabetes, for hypertension, for I don't know what. And with this medication, you keep the situation under control, but very often you do not heal. This is how I'm trained. This is how medical knowledge developed for centuries, and we have an enormous amount of knowledge about genes and very much biochemistry, etc. But the new way of thinking is the right drawing, and we need to add that, and that's also a scientific approach. it's about a bowl, and the shape of the bowl keeps the green bowl, the bowl and the ball. It's difficult. You can understand that the shape of the bowl keeps the green ball in place, but in a different way. And this drawing comes from ecology. How is, in nature, a system in a kind of harmony? This is about harmony and balance. And this drawing, this is also a scientific approach, and with mathematics and you can really calculate how deep and stable the ball is. The big difference is that on the left-hand side you create an equilibrium, but it's static, and on the right-hand side you create a dynamic equilibrium. And the right side is characterized by a system with many different factors. Well, this is what is now approaching, and it's very much people recognize it. It's not meant that we should leave the left-hand side fully, but we need to learn to think as in the right, on the right-hand side. And this is exactly what I experienced myself as a patient. Now I give you examples. You're all making pictures, but I guess they get the presentations if they want. Okay, then I go on. What do we know about strengthening this homeostasis and resilience? I give you 3 perspectives. The first one is about a sense of coherence. I don't know if you ever heard about Mr. Antonovsky. He doesn't live anymore. He was an American-Israeli medical sociologist who worked in Tel Aviv in the hospital, where he studied patients. And you may know or may not know that after the Second World War, the few Jewish people who survived the concentration camps very often went to Israel. And in this hospital in Tel Aviv, he met many of these older people who had survived the concentration camps and were ill. And many of these people were very traumatized. But what surprised him that within this group there was a smaller group who had the same experiences and who was not traumatized. And he decided to study what is the characterization of the people who have these horrible experiences and still more or less are healthy. And he found 3, you can say, characteristics, which together he called the sense of coherence, the comprehensibility, the manageability, and the meaningfulness. And what is that? Comprehensibility means that you somehow understand the situation. You are not in confusion. The manageability means that at least a little bit you still feel in control. So you're not completely a victim. And with these people in these situations, and I worked with them, these are the people who say, I still think my own thoughts. They take everything from me, but I am in control of my thoughts. And the third factor is the meaningfulness. So experiencing some kind of meaning in your life. And he said this meaningfulness is the strongest of the 3. And you may know Viktor Frankl, the very famous psychiatrist who spent several years in the concentration camps, educated by Freud, saying sexuality is the deepest drive. He knew Adler, who said, no, people want power. After the concentration camps, Frankl said the deepest need and strongest healthy-making power in people is the meaningfulness. So he said he started the logotherapy to help people to find their meaning. Okay, this is one factor about resilience. You may know the blue zones across the world where people get very old without chronic diseases, without mental retardation. So it is possible, and it depends on lifestyle. Do you know why these areas are called blue zones? People say, is it because are they near to the sea? No, it's very, very simple. They had a big map of the world and they had a blue felt tip pen. And because the pen was blue, they call it the blue zone. So nothing mystical about it. But the interesting thing is all these people have different genes. From Japan to the Mediterranean, Western United States, their lifestyle have things in common. And the 4 most basic characteristics of the lifestyle is the nutrition. These people eat freshly prepared food. They eat more or less, no, very little animal proteins, so they eat mostly vegetarian, and they eat moderate. So when they're well satisfied, they stop. They do not eat till it's completely filled up. They move in a natural way, so not just on sports schools, but still they're very old, they still are very much moving. And that's what we usually hear. But the other two factors are just as important. All these people have a daily life which they experience as meaningful. Even till old age, they get out of their bed because they're going to do things which they love. And so retirement is not really something. They work a little less, but they're still active. And the fourth factor is that all these people have a connection to other people. It may be a village community, it may be a big family, it may be a religious community, but being connected to a group is very good for your health. Real loneliness even kills more years than cancer. That's the second factor. Now we go to my own work. I told you that I was not allowed to call resilience health. And it is because we have a definition of health of the WHO, which is already from 1948. I respect the WHO very much, let me be clear. I studied the minutes of the starting of the WHO, and these people were very idealistic. But they made a definition which at the moment is problematic. But this because they say health is a state of complete physical, mental and social well-being, and not merely the absence of disease or infirmity. So it's a state, so it's always that. And then physical, mental and social, nice, broad, but then complete, yeah, well-being. So this is not really, what they never wanted, this stimulated the medicalization, because if this is your target, you can diagnose with everybody something which you have to treat. They had never thought about that because they thought the diseases are infectious diseases, and since the Second World War they had antibiotics. We're going to push the diseases out of the world. They had never expected we got other different diseases. Anyway, I worked on resilience and I came into contact with my government here, and they said we have a big problem because this definition is holy. We need to make our policy aim at that, but together with, we had a big conference where together with the really big shots from all over the world, we discussed 2 days about a new definition. And this is what we proposed. By the way, we don't call it a definition, but a general concept, because it's a more characterization than a demarcation. This is health and not. We formulated health as the ability to adapt and self-manage in the face of social, physical, and emotional challenges. So we had the same domains as the WHO, physical, mental, and social, but not a state of complete well-being, but on all these areas you get challenged all the time. That's the fact of life. We always come in new situations, and the question is, can you find a relationship to that? Can you find an answer in your own way? Like our immune system is all the time answering the bugs that you meet. This is how we described health. This is the beginning. It was published by the British Medical Journal, and now it's cited all over the world. I will never probably experience that the WHO changes definition, but many people embrace it. This is about resilience, and I got a follow-up task from our government, and they say, now, evaluate the support for this and operationalize it. And I got many groups of people I had to study. I studied many different types of patients with different diseases, physically and mentally. I studied healthcare professionals, doctors, medical specialists and general practitioners, physiotherapists and nurses, policymakers, health insurances, public health, citizens and researchers. I interviewed 140 people that I asked the same questions in a qualitative study, and the results I put in a questionnaire and checked that with these groups, and I take you with that. My first question was, what is positive about this concept? And I was overwhelmed by the positive reactions on this. Especially the patients were the strongest. I spoke to many patients. They say here the focus is on the whole person. As a patient, I feel addressed in my strength, Okay, I have a disease, I have a diagnosis, but besides that, I have a lot of healthiness, and that is now addressed, and it has potential. You can strengthen this. So enormous amount of support. But I also asked what is negative about it. And there were some people say, how about disease? Do you treat disease because it's not in there? Well, let me be clear. Of course you treat disease if it's necessary, but see the whole person, not just the lung or the liver or etc. See the person with the disease. The second hesitation was, is everybody capable of that? Of course not. But you don't have to be capable. You need to stand beside a person and help him or her strengthen this. And the third, more maybe negative approach was, how about the social environment? People said, this is very neoliberal. You can point it and say, it's your responsibility. Well, in the way we elaborated it, you will see it is very social. But I also got advice in these questions, and that was that people said, you're working on health, but make not health itself the aim, don't make a health industry, take health as a means to a meaningful life. And I heard that so many times that I thought I need to do something with it. And I realized that meaningfulness is part of Antonovsky's work. Meaningfulness is in the blue zones, and now I was addressed also. So I thought I'm going to introduce meaningful in my elaboration. But I had to operationalize it, and I also asked to the people, where do you look at if you want to evaluate health? And I came home after 140 interviews with 556 indicators of health, very broad. So we categorized it, and we also gave it to a different research institution, and we finally, in consensus, brought it back to 6 dimensions with underlying aspects. And these are the 6 dimensions with how we could categorize the things that the people said. The bodily functions, the mental well-being, the meaningfulness, the quality of life, participation, and daily functioning underneath. And then you're going to look at your spider web, but we do that later. I make a jump now to the evaluation with the questionnaires. So we had these 6 dimensions with underlying aspects, and then we took the same groups, the stakeholder groups, and we altogether had 1938 people who participated. All nice groups, just the insurers were at that moment not so interested, now they're very interested. And they were asked about the positive and negative judgment of the concept, and these were fully supported, very much support. But then these 6 dimensions, and now it comes, because this graph is crucial of how it went further. What you see a horizontal axis at the bottom with 6 words. These are the original terms. It's the bodily functions, the mental well-being, the meaningfulness. At first I had a spiritual dimension, but doctors are allergic to that, so we call it meaningfulness. Quality of life, participation, and daily functioning. On the vertical axis you see numbers, and people had to evaluate if you think having social abilities is connected to health, you say yes, you give it a high number or a lower number. The colors are the 7 stakeholder groups that I had, and in one glance you see that at the left, where it's about the bodily functions, everybody agreed that these words were connected to health. But if you go to the right, you see these lines diverge immensely, very significant differences between the different groups about their opinion about what health is about. And if you take the top line, the green line, these people say more or less all 6 dimensions are connected to health. And these are the patients. 575 patients said health is really about this. The lowest line, the purple one, scores the highest at the physical part and does not get that high anymore. These were the Dutch policymakers. And of course they were Dutch, but I don't know, even in different countries it will be different. You see the strengths and the tension between the patients and the policymakers. Now, if I go closer, you see the third line is a blue line. These are the people who healthcare providers. And if I zoom into that, here the patients are purple, the green line are the nurses, The gray line are the physiotherapists, and the blue line are the doctors. If I show this to general practitioners, they say, oh, did you just ask medical specialists? No, we had 50% general practitioners, 50% specialists, and they had exactly the same meaning. They say, now then we are a little bit more conservative, but the trend is the same. Then I show them this, and this is quite confronting because this is the educational level of all the participants. And you see several lines very close together. And at the bottom, this blue line are people with an academic education, university education. So there happens something at the university which makes you think a bit different from other people. I don't know if I shock you with this, but we still have work to do. The final slide I like to show is this. I asked everybody, do you have experience with disease yourself? So more serious than just some illness, than the flu. The green group has no experience with illness, and the blue group has. And what you see that at the physical part, they did not change their mind, but the people with experience with illness at the other 5 dimensions evaluate health as broader than what people without experience. So I had 2 groups. I had a difference between a narrow interpretation, especially with the policymakers and the doctors who said, yeah, practically it's about just the physical part. And they said the rest is not health, that's about life as a whole. But the patient said health is about life as a whole. And I decided to follow the interpretation of the patients, because in Holland we say we place the patient central. And doesn't discuss whether it succeeds, but if you say we place the patient central, you need to know how the patient thinks, and that means they say health is about life as a whole. So I followed that broad interpretation, and I needed a new name, and I could have called it broad health, which I didn't find, did not sound nice. I took positive health, which I write with 2 capitals, because the word is not new. Positive health because it connects to positive psychology, but for me very important was, I told you I studied the minutes of the WHO, and I found a discussion with the WHO whether they should use positive health. Finally, they decided to use health, but I thought I connect to their intentions, I call it positive health, and because it's our interpretation, we write it with 2 capitals. We visualized it in the spider web diagram, which you see here. And very crucial about this spider web diagram, that along the axis there are numbers. And this is the Dutch school system of 0 to 10. And from the moment this graph was there, people liked to evaluate themselves and to ask themselves, how do I feel? What number do I give my quality of life or my social participation? And you must realize there are no external norms. It starts to stimulate self-reflection if you fill out this spider web. It's self-reported health. Then you have your health surface, and then a very important question is, would you like to change something? And then we look for actions. And why do we ask if a person likes to change something? Because we're easily, as a trained doctor, tell the person what he has to do. But people don't do so easily what they have to do. They do much more easier what they want to do and what is of value to them. And I don't know if you know Antoine de Saint-Exupéry. This man wrote the beautiful book, The Little Prince. And he said once, if you want to build a ship, do not ask the workers together who do not give orders and instructions. Instead of that, learn people to dream of the endless sea. And then the ship will come. So he turns around, he first takes the dream, and then it becomes practical. Now, if you see this evaluation in a graph, what do you think? Most people who work in healthcare will immediately look at the DENT, the lowest score, and then think that should improve. But we turn it round. We're not going to say this should improve. We ask a person, what do you think about it? Is there something you would like to enhance, to change? And if you follow what a person mentions him or herself and then ask, and how could you do that? They come with examples I would never have thought of. But I found that when you really do that, this can happen. It's incredible. If a person, and this is a bit charged, but it doesn't go that fast, but the clue of this picture is that if a person follows his or her ideal, dream, and really takes action, then you see the scores on all the dimensions raise. And people say, but this is well-being. Yes, it is well-being. But I don't call it well-being because otherwise the medical section will immediately shift it to the social domain. But this is how positive health works. And we have this big graph now. This is the second version which we evaluated. This is my positive health, and it's now embraced all over different languages. We have it in German, we have it in French, we have it in Spanish, and we have more languages because it's embraced in many places. And we publish everything in literature. But beware, you see numbers, but it's not a measurement tool, and I want to warn you for that. It's the dialogue tool, because in an elderly home, they showed me these two pictures. And there's a Swiss artist who clears up life. And here he cleared up the sky. And I knew it, but what they told me in this elderly home, they said, our people, our clients, experience themselves as the left picture. But then our educated healthcare workers come with validated questionnaires like the right picture to get to know our clients. And our clients say, this is not about me, we don't want it. And they say, you should realize that if you want to measure and you use questionnaires like that, you do not teach the experienced reality of the people. And your graph, your spider web, connects to the left picture. So we realized we should really stress that we speak about a dialogue tool. The spider web is a dialogue tool to start the conversation. I know from being a researcher how important measuring is, so we do have a measurement tool underneath hidden. If you need to measure, and you can use it if you use our digital questionnaire. But usually the biggest aim is to start the conversation. And we say working with the positive health about three elements. The first is filling out the spider web, which can be confronted, but it stimulates a self-reflection. You start to think, how am I? How is it? And then we train the professionals to have the alternative dialogue, which means that you ask, what is important to you? Would you like to do something, to change something? So you have open questions like you are a coach. And then you remain quiet. And that's the most difficult for doctors, to teach them to keep their mouth shut and listen. It takes a lot of time. But once they find out, they are enthusiastic. And then the third step is, if you want to increase something, and what do you think of yourself? And that is very important, that people should have their own ideas. And of course, you can support them if it's necessary. But we first ask them, what can you do yourself as a small step that you take action? And it was not intended, but going along the way, I discovered these are the three factors of Antonovsky. The spider web enhances the comprehensibility. People get an overview over their life. The question, what is important to you, is the question about meaningfulness. We do not ask, what is your meaning in life? That's too difficult. But asking, what makes you smile? What makes you happy, etc. There is the direction of the meaningfulness. And then taking a small step makes you a manager of your own life. And we may show this picture. The steps need to be so small, and we ask them, can you do them every day? That strengthens your intention to go into the way of where your dream is. Well, be practical. My work was about adults. We have a children's tool. We have a youth tool for adolescents. We have a version for people with language problems, because we know that we do everything science-based. We publish about it. We have little spiderweb blocks for the professional desk. We have it digitally. where it can also be read to you. We have a simple folder, a brochure, which is on the back side, a very simple spider web. And we have now a book, a handbook of positive health in primary care, the Dutch example, because it's used so much. And these are my two colleagues where we presented at this place, the English translation of this book. The clue of this book, is that of course, it gives us the general background of positive health, but it has these different colors where we describe. The yellow one is about how is the conversation with your client. But the pink one is how do you organize your team, because you have a different approach. You are not directing, you have to do that, but you are very much more coaching. The green level is how do you cooperate with different professionals, because all these dimensions are not medical and not mental. They are social and they are very practical. You need to cooperate with professionals for support in all these different areas. And the blue thing is how is the system organized? How is it financially, with privacy, etc.? We describe all that. Now, it must be clear, positive health is about enhancing a resilient and meaningful life. But you need a supporting environment. That's just as important. So we place the person central, but is it possible to have a good lifestyle? Is it possible, is there a supporting community? Is there a financial income? If this is lacking, it's also very difficult. And I'm very proud that by now the Dutch government is embracing it and made a health policy document which went to all the communities in the Netherlands, where they describe what the communities, the local communities and the cities can do to support this. Now this is developing more and more, and this is all about how you can create this right-hand side situation where you create a community, a system around a person where you get this dynamic equilibrium. Now, this is about positive health. The spider web is, everybody I think has a spider web. If you don't have it, we have it here also for you. And maybe it's nice, unless you have very urgent question, that you just very shortly fill out your own spider web and experience how it is to give yourself, to evaluate yourself. Who needs a spider web still? Jan, here, Jan. And the best thing is to do it on paper and not the digital one, because in the paper you give a kind of average of the different words and you kind of give yourself intuitively a number and then make your health surface. Please be quiet for a moment, because you really need to concentrate to be honest for yourself how you are. please realize by reading all these words, you start to reflect, and it may be confronting, but did you read a word where you think, the question is, what would you touches your heart and is important to you? And is there something which you like to give more attention to? What would make you happy? Is there a quality that you say, I would like to give it more attention? And if you find something, can you then think yourself of an action which is very small, like the little, you saw the staircase with the little steps, a small action which would strengthen what makes you more happy, what is important for you. What small action could you do every day, give a short moment of attention where you would strengthen to grow in this direction which would make you more happy? Write it on your paper as a memory. What is your small daily action? And if you think of a small action, what is your action to grow towards? We have a Dutch proverb which says, one thread a day makes a sleeve in a year. And this is how it works. But if you have written your little step, my next question is, why are you not going to do it? Why are you not going to do what, in case you know, would make you happier? Well, this is normal resistance. It is not a disease, it's abnormal. We all have it, but it's good to realize your own resistance. And the last question is, how can you overcome your own natural resistance and give attention to what would make you more happy? I ask you to do this exercise because we think working with positive health is not a trick. It's being generally a human being. For everybody, whatever professional you are, you're also a human being. And this is not about some specialization in disease. This is general increasing your well-being and your positive health, you can say. Now, maybe so far we have time for questions. If you want to know more, we have this this Institute for Positive Health, IPH, but we also, a colleague of mine, one of the co-authors of the book, started the Positive Health International. They give trainings in this dialogue form in English, in different languages, so if you're interested, you can look there. We still have some 15 minutes for some questions. Yes, can you come to the microphone? I learned that you have to do that.
Thank you, Doctor. I won't try and pronounce your name in Dutch, because I can barely speak English, never mind. My name is Michael, I'm from Ireland, and I just want to thank you for your presentation.
Thank you.
It's been one of the best I've heard at the GLE, and just to endorse really what you're saying, I suppose, from the concept of recovery in mental health, we would work off the Mike Slade and Mary Leamy study around, what helps people recover in mental health, and they identified 5 concepts, all of which you've touched on, in terms of hope, meaning, identity, empowerment.
I read at the same time what you're saying, so this is wonderful. Thank you.
So I really think it is that move that away from symptomatic approaches to recovery, and we said that recovery is not about cure, but it's about becoming the best person you can be, the best version of yourself,
Exactly.
as Patricia Deegan would say.
Yeah.
So I really think that this approach is very beneficial, and I see a great possibility of using it in the recovery education and recovery college structures. So I just wanted to thank you for that.
Thank you very much. I've been several times already to Ireland to speak to the general practitioners there, so they know it. But maybe you could find some doctors who also want to develop it further. So yeah. Great, thank you.
Thank you very much for your presentation. I'm Rachel from Western Australia, and I'm also going to just say that there's a great potential, so thank you very much for all your work, but in the context of children and young people with intellectual disability, often whom have not had accessible health information. So I'd love to have a chat to you about what it might look like to use it and empower families to start thinking about positive health in that context. And particularly, we know that many young people with intellectual disability fall off a cliff with respect to the health services when they're transitioning from paediatric to an adult setting, because it goes from being reasonably tight, I suppose, to a very fragmented approach. So it'd be really terrific to think about it from that context of what skills can we support young people to learn so that they are basically partners in their healthcare. So if you have any interest, I'd love to chat to you about it.
Yes, I'm around still a little bit. Sit down. The next group who addressed me were the people who work with children. And they said, this is what we also want to develop for children. And it's the children's tool is made with an enormous group of children and their parents, but also with children with disabilities. They are used for that. They evaluated it, and the children love it. They say, really, this is about me. I'm very happy that even in the Dutch schools they start to use it and have programs or projects where the children learn to evaluate their well-being and think of what they need and could do together with maybe their friends to increase their well-being. This is really where I think that is the most important. And I hope to experience that will grow too. But well, we can have a chat. Yeah, thank you. More still. Yes.
No question? Yes, perfect. That's easy for me. I can
Oh,
just,
yeah, you're recorded anyway.
Yeah, that's great. That's great.
Can you just stand up?
Yeah, that's a good one. All right. It's more of a personal question, actually, because I imagine you filled it in for yourself as well. So, because you're talking about small steps, and I think that's you want to aim high, but yeah, so how do you do that yourself? Do you have an example of a moment where you thought, oh, this dimension I wanted to change, and I did it that way?
For myself? Mm-hmm. Now, I first given 2 examples from practice. Mm-hmm. You can sit down.
Thanks.
Now, you know what it is? I give you examples now. I first tell about myself. During my diseases, I had this. I didn't have the spider web. That I developed that later. But what I learned is when I was tired. I started I was practicing to ask my body, what do I need? I'm tired. Should I sleep, or should I make a walk in the nature, or should I listen? What? And then I tried to experience. I imagined if I would sleep now, how would it work? If I would walk, and maybe I should say that later I was trained as a Gestalt therapist as well, where you use that you really ask your body to answer what would make me feel good. And this is, if you use this spider web more often, you find that from yourself, we call, in Dutch you call it eigenwijs, that's your own wisdom. We all have our own wisdom within ourselves, and that is what we try to address. Now, and I have from my colleagues examples. a young girl with all the time pain in her belly. And mother was had a lot of anxiety, a child with diabetes. And they went to all the kind of specialists and they couldn't find what was wrong. And the child got from the doctor this spider web and immediately said, I know what it is. My mother is so worried about my diabetes, she doesn't allow me just to go out playing with my friends. That is it, that is why. And the mother was surprised, and so the general practitioner coached them for the mother not to be so afraid anymore, so the child could go and play with her friends, and gone were the stomach pains. Another example is the old lady, a widow, who each week came to the general practitioner because she had such arthrosis in her knees and such pains, and the doctor had given all painkillers that existed, and it didn't work. And one day he said, shall we now, I have a new method, shall we fill out the spider web? And the lady filled out the spider web and started telling, I'm a widow, and my husband and I had yearned for children. We wanted so much children, but we never got children, and I'm so alone. And then the doctor thought, this morning in my office, I had a young woman who has a kindergarten, and she is nearly breaking down because of all the work. I contact her with the young lady with the kindergarten. So this old lady went there to help, and she didn't come to the doctor anymore. And weeks later, the doctor met her on the street and said, how is it? Oh, it's so wonderful, but your knees. That will remain, but with the children, it's so nice. You know, this is how it works. Or the man who comes to the general practitioner with big overweight, tried all the diets, dietitians, etc. And doctor, can you help? Now, they fill out the spider web, and he's really looking at it and thinking, what am I doing, my work, etc. And he finds what is really important for himself and decided to go on that track. And the doctor doesn't say him, but meets 2 months later his mother, and the mother says, what have you done to my son? He lost 20 kilo. What happened? And it was just because finding your own goal is such a deep need. And the spider web is a help to find it. And then you may need some time to think of your own actions, but you need to find the actions where you feel this helps me. Now, maybe so far. And now I nearly have to... Oh, question. Hi.
Thank you very much. That was really interesting. My name's Nigel. I'm from Scotland, and I have had a sense of déjà vu today, because about 15 years ago in my organization, we developed a spidergram called I-ROC. So I-ROC.
Yeah.
So the individual recovery outcomes counter. So it's been fantastic to see this. But I have a question for you, which is, you're a GP, you will be a member of your professional body.
I'm very retired.
But how do we start to change the education of our doctors?
That is a long process. Thank you. I realized we are in a process of, you have to develop a new culture. When I decided, based on my own experiences with illness, I decided I want to change healthcare, but this is a system which is already there for maybe centuries, built on. I developed, the first thing is, this is all science-based. So this helps very much to be accepted. People accept me because I'm a doctor speaking to doctors. That helps very much because doctors only listen to doctors. I'm sorry, don't. This is how it works everywhere. And at each congress where I speak, there are a few doctors who come to me and said, this is really, especially medical specialists, this is what I would like, but my colleagues. And at the moment, positive health is really very much embraced and very popular in Holland. And that is because I have given many talks, because people go on inviting me to do it. And in each, you can say in each audience, there are a few people who say, this is what I want. And I say, if you want it, because they say, I sense this this is good. I say start to experiment and look for polls, other people, and make a coalition of the willing. And in your own situation, look for the chances that you see to start to experiment with it and do a training and communicate about it. Because this is about changing a culture. And we have this education system. I was very proud already 4 years ago when positive health was included in the global plan for the Dutch doctors, medical education. We have 8 universities, so it was in the you can say the umbrella plan. Wow. So we addressed all the different faculties and said, can we help to include it in your curriculum? And they said, well, if something needs to come in, something else needs to go out, so that was difficult. But we have it now it's in the education of physiotherapists, it's in the education of nurses, it's in the social education. It's really, at the lower levels, it's included already everywhere. I meet many workers who say, I had it in my education. There are hospitals who want to include it, but what we're now doing, I showed you this policy plan for the country. Now they're trying to reorganize our country into regions where the hospitals and the general practitioners and the social domain starts to cooperate. But this change of culture takes maybe 2 generations, but you have to go on and find other people who want it as well and just do it and communicate about how it works. And connect with what I showed as Positive Health International, where you have this network of different countries, of people who are working on it. So it's spreading all the time. Good luck. And now I have to stop. So, yeah? Oh, okay. Thank you.
Thank you so much, Machteld. I think this was a really interesting talk and broadening the perspective from, like what you said, not only solving problems, but also creating resilience and the whole positive side. So, very nice. Thanks to have you here. All right, folks. I think you will like to hear this because it's time for an afternoon break again. See you back here at 30 minutes. Yes, thank you for the closing session almost. So
back at 3, please.
Yes.
Happy to have, not to have not. Big business is very wise. I'm crossing over into enterprise. This is not a love song. 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 I'm adaptable now. I like my new rule. I'm getting better and better. I have a new goal. I'm changing